This. From today, more than 10,000 pharmacies across the country are going to be given new powers to treat patients. It's the Pharmacy First initiative, and it's aimed to free up about 30 million GP appointments a year, where pharmacists can treat mild conditions in people aged 16 to 64.
So, pharmacies will offer consultations without needing a booked appointment to treat and prescribe medications for conditions including earache, sore throats, sinusitis, shingles, impetigo, urinary tract infections and infected insect bites.
For one person who firmly welcomes the launch of the scheme is Chair of the National Pharmacy Association, Kaye. Thank you so much for your time. This seems like fairly good news. Pressure off GPs and we can instead go to our pharmacy. Talk us through how it's going to work.
Yeah, so thank you for having me on. This is, really welcome this announcement. First lot of new investment in community pharmacy in over 5 years, and really great that people are going to be able to walk into a community pharmacy without an appointment, and then, as you say, be assessed by a pharmacist from one of these 7 conditions, and then, if required, we'll be able to give you a medicine that would have normally been given with prescription without seeing the GP. So, quick, easy access to these first 7 conditions, which we really welcome.
Why has it taken so long? This seems so obvious, so practical and so easy to implement. Why now?
Yeah, no, I think that's really, really important to say. So this is being launched and it's, like I say, really welcomed across England. But I normally practice in Cornwall and we've had iterations of this scheme for nearly 10 years for some of these conditions. And that's been replicated in different regions across England. What this is really doing is taking all of that great stuff that we know works sort of at a local level and then really pushing that at a national level, and to see that unified across England. So everybody knows, as you can say, you can walk into 9 out of 10 pharmacies from today and get treated with one of these 7 conditions is a really good, clear message and really a first building block for where I see community pharmacy moving in the future.
It also reflects what quite a lot of European countries have in a different way, where you just go to the pharmacy instead. I think for the GPs, this is definitely great news. Potentially for us, if you're battling to get an appointment, it's good news. From the pharmacy, from the pharmacist's perspective, this is presumably a lot more work, a lot more admin, a lot more responsibility.
Yeah, so I think that's really fair. I think what we're actually seeing here, though, is, yes, there is that increase in work, but actually with this announcement is we do get more funding for this. So it is a properly funded service. So we're welcoming this in that way. You talked earlier about NHS crisis and all those other things. We would say that community pharmacy in totality, its core part of its budget has dropped in some funding, and you've seen that reflected in some pharmacy closures. Community pharmacy actually makes up only 1.6% of NHS England spending, even though the increases, as you've heard about, have been there, flat funded in England for over 5 years. So I think there is some underlying stuff around the core part of our contract. But for this today, this announcement, new funding, new investment, skills to be able to do this and get that prescription medicine, as you said, easier, quicker, helping our GP colleagues, being really part of that first stop, that front door of the NHS as we see community pharmacy as.
Just finally, one of the wider concerns, though, is the number of pharmacies financially struggling and having to close.
Yes.
Why is that happening? And do you think we've therefore then got enough if they're going to fulfil quite a critical role that we would have been having at our GP instead?
So I think that's a really, really key point, and that links back to our sort of core funding model that we talked about before. Community pharmacy has been flat funded for the last 5 years, and that's why you've seen large change like Lloyd's collapse. You've seen, pharmacies closing up and down the country. What this, though, does is it does invest in our skills, a new investment for new service, but we would certainly challenge the core part of our funding model. That dispensing part is really, really struggling. You'll see that in medicine shortages, potentially in other news stories across the media last week. But for today, pharmacy first, new service, new investment, we certainly welcome that.
OK, Nick, thank you very much indeed. That's Nick Kaye, who is chair of the National Pharmacy Association. Let's speak to someone on the other side of the fence, NHS GP and broadcaster Dr. Ellie Cannon, who also joins us this morning. Good morning, Dr. Ellie. Do you think this is going to make a difference to your working life?
Yes, I really hope so. I mean, I've long advocated for people to utilise their pharmacists more. Pharmacists are really well trusted in the community. A lot of people go to their pharmacy for health advice already. So I think giving them the agency to treat these 7 conditions help our patients not have to phone up in the mornings for a GP appointment, wait for an appointment, because this service will be pretty much straight away, I think is a really good thing.
Are you concerned about losing control or losing track of what your patients are potentially suffering from and taking medication for?
No, absolutely not. Obviously, these conditions have been chosen because they are something that are treated in isolation. Of course, the pharmacists anyway would be letting us know. That would all be done electronically, so it would actually be included in the patient's notes afterwards. And pharmacists are very important parts of primary care. Many GP surgeries now have pharmacists working within their GP surgery, and even if not, GPs like myself have very close links with our community pharmacies that our patients go to regularly. So this is certainly not a concern about losing any control.
Some sort of safeguards have been put in place, haven't they? Like the age limit. So anyone over the age of, I think, 65 still has to go to the GP. Presumably that's because there's a nervousness that maybe some age groups, children, for example, I don't want to say 65-year-olds are elderly, but the older population maybe do want to have that face-to-face contact with a GP.
Yes, absolutely. Well, there's a vulnerability there. So, of course, in children, we're always more careful when children are ill and people over 65, so we don't miss anything more serious. The idea of these very specific conditions that were chosen, like impetigo, like simple urinary tract infections, are that they are just that. They are simple conditions and they shouldn't be a sign of anything else. That's why other conditions won't have been chosen. For example, like a chest infection, somebody with a cough does need to be looked at by their GP. And those sort of conditions in somebody young or in somebody over 65 may indicate other problems. So I think the age limit is really very sensible.
Dr. Ellie, thank you very much indeed for your time this morning. This does sound like, I said it was a miserable Wednesday, but this does sound like a good news story. We've been